Welcome to Cybersecurity in Healthcare, what hospital executives need to know. This is part 3 of a 3-part series. In our first session, we defined terminologies and talked about the threats and the attacks that have been occurring. In part 2, we talked about the trends that we see, and we talked about malicious code. In part 3, we're going to focus on safeguards and controls, as well as how to be prepared for a board presentation. In particular, for this session, we're going to discuss the lines of defense for cybersecurity, and we're going to also, again, provide some guidance as far as for our board of directors, as well as some questions you might anticipate that the board would ask regarding cybersecurity. I'm Tom Walsh. I'm a certified information system security professional, and I've been doing information security since 1992. I was doing it when it wasn't even cool, when hardly anybody knew what it meant. Let's talk about our safeguards and controls and what can we do to address some of these cyber threats that we have. And one of the things that I often hear is, well, we're compliant with HIPAA, so that should cover it, right? No, not at all. You know, HIPAA it's the floor, not the ceiling when it comes to security controls. Keep in mind that the original HIPAA security rule was created in August of 1998. Do you remember what computer technology was like in 1998? There was still a lot of mainframes and dumb terminals floating around the hospitals, or what we called green screens, if you can remember those. The rule was modified slightly in 2003 from the original proposed rule, and there's been no modifications to the rule since except to include business associates. So other than language to include business associates into the rule, there's really not very many changes. So when somebody says they're HIPAA compliant, what that tells me is they're complying with a mainframe standard essentially that was written back in the late 90s. Whoop-de-doo. That doesn't help us much when we're talking about the world of cybersecurity. In fact, what I want to point out to you is what a lot of people don't do is they don't actually take the time to read the rules and understand what it says. On this slide, you'll see a lot of words. My point here is none of these words appear in the HIPAA security rule, nor do they appear in some of the tools that the government uses to assess HIPAA compliance or to audit covered entities and business associates. These words represent threats and risk in the cyber world. So we need to take a different stance. Compliance does not equal security. We need to secure our data. So we need to develop a cybersecurity plan. And our first step in developing a cybersecurity plan is we got to identify risk. We got to know where our risks are. Where are we vulnerable? So a good risk analysis identifies the reasonably anticipated threats based upon a particular IT asset or application or system. From there, we look at what controls do we currently have in place to address that threat. What are the remaining vulnerabilities? What's the likelihood of this threat exploiting those controls? And what would be the impact if that threat was realized? That is a thorough risk analysis. And that's our starting point in addressing the risk that we need in the cybersecurity world. When I look at the breaches that get reported, I always try to find what was the root cause behind it. And in many cases, it's because systems were not properly patched or maintained with the current security updates. So it seems like a simple thing, updating your system when a new operating system comes out or when a new alert comes out. But what you'll find in healthcare is we run some systems where the vendor tells us, don't update the operating system. If you do, you void warranty, or if you do, you're no longer in compliance with our service agreement as far as maintaining these systems. So it puts us in a tough position because we have to run systems then that are not properly patched, which creates a greater vulnerability in healthcare. We need to improve our identity access management. And in here, I'm talking about passwords, because passwords are the most common tool we use today to authenticate a user. And then later in this presentation, I have a slide about passwords and why we need to strengthen our passwords. If somebody's coming in remotely to support, they should be using two-factor or some form of stronger authentication. And by two-factor, I mean more than just another layer of passwords, user ID and passwords. Two-factor means something you have and something you know. Or it could be something you are, which would be a biometric. So that would be like an iris scan or a fingerprint. We need to implement mobile device management. These mobile devices represent a huge threat to the organization. We don't know what kind of software or apps people are downloading on their devices. Free apps are the worst apps, and I try to tell people that. There are apps that go out there and they do what's called jailbreaking or rooting. If it's an Apple operating system, it's called jailbreaking. If it's an Android, it's called rooting. And what it does is it circumvents the inherent security controls in the device in order for this app to run. That should be your warning right there. What a lot of people don't understand is how much access you give an application to your information. Most apps can read your contacts, and if you have your geolocation turned on, they know where you're at. Is it any surprise to you then that you're in the supermarket on the canned good aisles when Groupon sends you a coupon for Del Monte sliced pineapple? Hello? Yeah, they know exactly where you're at. There's no disguising that. So we want to make sure our users are doing the right things. A mobile device management software will actually monitor the device to see if there's malicious code or applications that do jailbreaking or rooting, and it will not allow them to connect to your systems if they find those. Continuing on with our cyber plan, we have to look at our firewall and what kinds of data we're letting in and out of the organization. We should refine our, as far as what traffic we let in. I mean, is there really any reason you need to do business with a company or organizations in North Korea or Estonia or Iran? You can begin to filter these out. In fact, I recommend you block all foreign countries by default. And then if someone actually needs to get through to a particular foreign country, instead of opening it up to the entire country, give me the IP address or give me the URL so we can filter it and put it on our whitelist and allow it to go through our firewall. Any email that comes in from a domain that's been in existence less than 72 hours, you should not let that email in. In my previous session, I explained that most of the phishing attacks, when they are coming in, the links that these guys set up are coming from websites that have only been in existence for less than 72 hours. In business, when an organization legitimately opens up a business and starts with a website, it's usually a good week before they're ready to start receiving or sending emails through that domain. I would say we're done with allowing employees to use hospital computers to surf the internet, whether it to be for just general surfing or to go get their personal email. They should be using their own smartphone or tablet and going through your guest wireless network so that you're not subjecting your organization again to these attacks. Now, many hospitals put a lot of controls in the front end of their email systems to prevent these phishing attacks, spam, and other forms of malicious code. But then when we allow an employee or a worker to use your hospital computer and use your internet to go out and check their own email, a web mail system, for example, they've just bypassed all those controls. They circumvented it because they're coming in through a back door. So I'd say it's time to let everybody use their own devices and if they have to do personal stuff, let them do it on their own device or at home. Don't need to do it at work anymore. We have to create an incident response plan. I said a previous session, security is not 100%. We do our best, but you know what? We can't stop everything. So it's not a matter of if, it's a matter of when. It will happen. And when it happens, we need to be prepared because the first 48 hours are very critical. In particular, if you are going to take some type of legal action, you need to preserve this data and preserve it well. I know that sometimes people react differently when they're under stress. And in a condition where you're responding to an incident, you may not be thinking clearly. So having well-defined systematic steps on how to approach any type of an incident or breach is critical. And then, just like the military and the firefighters and the police department, you have to drill. You have to practice it, because practice makes perfect. And you will find when you go through some type of a tabletop exercise, much like you would do, for example, for disaster recovery, you're going to find there's holes in your plan and you're going to need to fix those. Conduct a phishing campaign within your own organization. We need to educate and make people aware, don't click on embedded links. And once we tell them there's consequences for doing it, because there are, it could be very damaging to the organization, they need to know if they disobey and they click on an embedded link without thinking, there should be some sanction. One organization used a tool to set up a phishing campaign, and when they sent this out, if the user clicked on the embedded link, it took them to a video of their CEO saying, obviously you weren't paying attention to our awareness messages, or you never would have clicked on this link. If you do something like this again, you could be terminated. That got their attention real fast, and they learned not to do it. All it takes is one employee to compromise the data security of the entire organization. So we need to make sure they're aware, and we test them to make sure they got the message and they're not going to click on something. You can't stop something or detect something if you're not looking for it. So we need to look at our audit logs. We need to monitor it. Now that's a lot of work. And a lot of organizations, that's not the best use of their network engineers' time. Therefore, they're outsourcing this to managed service providers. And their whole job is to look at certain key information systems, servers, applications, and they're monitoring those logs to see, do they sense there's an intrusion? Do they find any vulnerabilities that they want to make you aware of? That, to me, is the best use of organizational resources, rather than to try and do it yourself. In some organizations, we find they have purchased security tools that come with a whole suite of other tools that they're not even using. So within your own organization, look to see, do we have intrusion prevention or intrusion detection systems, IPS/IDS, that we're not using? Maybe it's time to turn those on and start using them as well. We need a process for vetting our business associates. If we're going to share data with them, they got to prove to us that they're securing it. Not HIPAA compliant, but that they really do have a good, solid security program in place for protecting data. You can't just put all your eggs in one basket. We need what we call a strategy of defense in depth, which means we look at the basic premise of why we put any kind of a control or safeguard in place. And I usually narrow it down to these four: prevent, detect, assure, recover. First of all, we want to prevent any incident from occurring. How do we do that? Well, one of the most common things we use is access control. We try to limit who gets access to protected health information. Our second would be detection. So if we can't limit people to the minimum necessary to get their job done, our next step is to make sure we're monitoring them, we're auditing them, we're making sure that they're not inappropriately accessing data. Assurance gives us the warm, fuzzy feeling. It could come in many forms. It could be a third party that comes in and conducts an evaluation. It could be a network vulnerability scan or some other type of test like a penetration test. So we know we're doing the best we possibly can. And finally, when all else fails, we're running a business. This is hospitals. Patients expect hospitals to be up and running. So we have to be able to recover no matter what. So we need a good disaster recovery plan and an incident response procedure and playbooks that we can follow. If then something bad happens, we can get back to business. There's lots of resource materials out there regarding the cyber threats that we face today. But one of the things I wanted to point out here is that the United States does not spend nearly as much money as other countries on cybersecurity. And remember, that means that we're the weaker target out there. So this is a global problem. Cyber attacks are affecting everyone. So it's not like it's just your local communities. They're going after any and everybody. And they're finding you, and if you're the weakest system out there, they're going to go after you. Early on, I mentioned about improving identity management and access control. In particular, I wanted to talk about passwords. I wish we could do away with passwords because, unfortunately, we find there's many weaknesses in passwords. I'm of the thought that if you have one good, strong password that you don't share with anyone, that you should keep it for at least a year, rather than changing it every 90 days and making it weak by just adding the number 1 to the end of the password you currently have, or using the month or whatever it is that you use to make it easier for you to remember. That's not a good solution. But if you need a password, make it as long as possible. Look at this table right here and just look at the difference it takes running a password cracking program to break a 7-character password versus an 8-character password. We're talking a difference here of 74 years by adding just 1 character, because it's exponential. If you've got a 4-character password, your password can be cracked in 30 seconds or less. So it's time to get good, strong passwords, keep them private, and if they are kept private, why are we changing them? Because once somebody gets into your system, it doesn't matter how often you change it. Once they get into your system, one of the first things they're going to do, change your password. So it doesn't matter when it expires. In all my years of doing this, it's only recently that information security or cybersecurity has become a board issue. So because of that, I want you to be prepared and know what to expect if you ever have to speak in front of a board. For your board members, there's a couple of resources that are available to them. And this slide shows you 2 different books that they could get, or I shouldn't say books, but pamphlets. One was put out by the American Hospital Association, and I'm going to go through that because they have some questions in there that I thought are good questions. And again, this is kind of my summarization of what was in the American Hospital Association pamphlet. But first of all, the question is, and you could expect this from your board or board of trustees, does the hospital have a cybersecurity plan? If so, who in the leadership has responsibility for that? I mean, and how do we know that they're doing that job? Are this the same person who's responsible for responding to cyber incidents? If there is an incident, when will the board be notified about it? Is there a particular committee, like an audit committee? Is there a separate committee for the board on just cybersecurity? And do we have qualified people who understand the issues in cybersecurity, who can speak knowledgeably about it? Does the hospital have cyber insurance, and will it cover a breach? Part of being a board member is your financial due diligence or due care and making sure that the organization's protecting itself. And then finally, has the hospital considered looking at the NIST cybersecurity framework? The NIST cybersecurity framework was not specifically written for hospitals, but it's a good framework that we can look at to see, are we doing everything possible to address cybersecurity? One of the questions in here was about cyber insurance, and I've actually heard executives say, well, we're not worried about cybersecurity, we got cyber insurance. Okay, well, cyber insurance only covers you if you're doing certain things. And this is a particular case I wanted to point out to you, and that is an organization called Cottage Healthcare System in California was sued by their cyber insurance company for the tune of $4.1 million. And the reasons given for this is they said that the organization, the hospital, or the healthcare system, excuse me, did not apply proper security patches, They had failed to replace the default settings. They didn't undergo annual security audits, and they weren't looking at their outsourcers, which is business associates. They weren't vetting them. So these were just some of the incidents that they cited as far as failures by the organization, and they wanted their money back. So cyber insurance is not the answer. It's just one of the many tools in our toolbox for addressing cybersecurity. So in summary, this third part of this session, what we talked about was how HIPAA compliance does not imply a good, secure environment. We have to look for additional safeguards and controls, and they should be based upon our risk analysis and documented into a cybersecurity plan. We need to be prepared to address questions from our board regarding our cybersecurity readiness. And there are resources available for our boards if they're not familiar with cybersecurity and some of the issues that they face. I'd like to thank you all for being here today and listening to the session, and those of you who are watching the session online, thank you very much.